Hi, my name is Dr. Natasha, and welcome to Pregnancy Health with Dr. Natasha. For those who don't know, I am a board certified OBGYN and a certified personal trainer and owner of Bump Fitness Club here in Arizona. So I like to hop on YouTube and give kind of tips for healthy pregnancy. Um, if this is your first time coming to the channel, please like and subscribe so you can stay up to date on all my latest tips and tricks to help you have a healthier pregnancy. And also, if you like what you hear, feel free to leave a comment. Let me know. I definitely appreciate all feedback. So, the topic that we're going to discuss today is the importance of a preconception counseling visit. So, what exactly does that mean? So, preconception counseling is the visit that you have with a women's healthcare provider. So, typically, it's an OBGYN, it can be a midwife, it can be a women's health nurse practitioner. And the whole goal of this visit is to optimize your health prior to pregnancy. So, one of the questions that I typically would ask patients would be, are you planning or considering pregnancy within the next year? If your answer to this question is anything other than an emphatic no, and you are taking active steps to prevent pregnancy, then you should consider having a preconception counseling visit. And so, during this visit, it's a very important time to go over your medical history. For example, if you have like high blood pressure, if you have diabetes, thyroid disorder, if you're dealing with anxiety and depression, this is the perfect time to make sure those medical conditions are optimized before you head into pregnancy. So we know pregnancy is tough on the body in and of itself. But when you have conditions like high blood pressure, diabetes, thyroid disorder that are poorly controlled heading into pregnancy, it does increase your risk for complications during pregnancy. And those complications can range anywhere from miscarriage to preterm labor and resulting in preterm delivery. It can lead to conditions such as having the growth of the baby being too big or too small. For example, like if you have another example would be if you have diabetes, then it could increase your risk for having high blood pressure during pregnancy. And so it's very, very important if you have a known medical condition to make sure that it is successfully managed before you get to pregnancy. The other thing that we review at a preconception or a pre-pregnancy counseling visit is your surgical history. And the reason why that's important, and when we say surgery, typically we're interested in surgeries that involve your abdomen or your pelvis. So if this is not your first pregnancy, have you had C-sections before? How many C-sections have you had? Have you had surgeries, other surgeries on your uterus, like DNC or dilation and curettage, or that, kind of the colloquial term would be scraping of your uterus. Have you had any surgery on your fallopian tubes and your ovaries? And so those are all things we can discuss at your visit, because sometimes depending on the particular surgery that you had and the timing of the surgery, it may affect how you deliver your baby, whether you're a candidate for a vaginal delivery or you would need to have a cesarean section. So again, that is something that we can plan for ahead of the pregnancy. If it's something that you have discussed with your healthcare provider and they are aware, let's say like you have a situation where you need to have a scheduled or a planned C-section. knowing that you need to have a schedule or planned C-section before you get pregnant allows you plenty of time to help deal with that situation and to make sure that we can optimize things to get the best outcome possible for both you and baby. The other important thing that we discuss, and it's a necessity during the preconception counseling or pre-pregnancy visit, and that is your medications. So there are some medications that you just absolutely should not take during pregnancy because they can cause abnormal growth and abnormal development and birth defects for the baby. Now, your doctor knows what types of medications these are. So it is important that if you are taking a medication that has been found to be unsafe for pregnancy and it's being used to treat a medical condition, and then we need to switch you to a safer alternative, and not only switch you to a safer alternative, but we need to optimize the dose or find the dose that is best of the new medication to control and treat and manage your condition. So for example, let's take high blood pressure. So there is a group of medications called ACE inhibitors and ARBs. And so basically those medications kind of treat high blood pressure by working on the kidneys. And so those medications, ACE and ARBs, are proven to affect the development and can cause birth defect in babies. So if you have hypertension or high blood pressure and you're taking one of those medications and you are planning for pregnancy, then you would need to switch to a different medication and then work towards a dose that controls your high blood pressure before you get pregnant. And now I say there's a lot of different medications. Some medications you actually, if there's no alternatives, then you can take it during pregnancy. But again, this is a conversation you need to have with your specific healthcare provider. You need to sit down with them, review your medication list, and they will go through and let you know this is okay, this is okay, this is all right, but let's try something a little different, and this is an absolute no, we need to change that. And so one of the things that I kind of experienced in my practice is I would get patients, they find out that they're pregnant, and then they would stop all of their medications. And they're on medications for conditions like high blood pressure, diabetes, thyroid disorder, and that's not what you want to do. Now, like I say, if you have any consideration of getting pregnant, you need to go talk to a healthcare provider, specifically a women's healthcare provider like an OBGYN, a midwife, a women's health nurse practitioner, and optimize your medication list. There are other things that goes into the preconception counseling visit as well. For example, your family history. Are there, certain medical conditions or genetic disorders that run through the family? Because what we can do is, if you want, we can test both you and your partner for those conditions. And then that way we can tell you the risk or the chances of the baby inheriting that condition. And again, it's just something that allows us to kind of prepare mentally for a possibility that could happen during the pregnancy. The other thing that we like to discuss is your vaccine history. So I know vaccines can be a sore topic, but there are some conditions that vaccines prevent that can adversely affect the pregnancy. For example, varicella. So varicella is the kind of medical term for chickenpox. There is a chickenpox vaccine. And so chickenpox, if your baby gets it while you're pregnant, it could lead to some pretty severe illness for the baby. So another common condition would be rubella. And so that's the MMR vaccine. And so again, that's something that if you haven't had chickenpox or your rubella titers are not positive, and then it will be a consideration to get those vaccines prior to pregnancy. And other things that we can discuss is your daily habits. So exercise, your diet, whether or not you use tobacco, marijuana, alcohol. Like those are all things that we can address before you are pregnant. So I just want to leave you with this thought. The foundation for a healthy pregnancy actually begins before your positive pregnancy test. So again, if I were to ask you the question, are you considering getting pregnant within the next year? And your answer is anything other than an emphatic no with active steps at preventing pregnancy, then you should consider seeing a women's healthcare provider for a preconception counseling visit, because it is very important that we try to optimize your health before the positive pregnancy test. So I hope you found this talk to be beneficial. If you have any questions, feel free to reach out to me at natasha@bumpfitnessclub.com. And then also, again, remember to like, subscribe, and comment. Let me know what you think. And yeah, so more content coming in the future. I hope you have a great day. Take care.